I was 17 when this first presented. And this is a condition where you have a narrowing of the urethra and it just keeps wanting to heal itself up and close up. And so back then, when I went to the first urologist I ever met, I could even give you his name, I'll never forget him. The treatment was graduated metal sounds. He laid them out, they were different sizes. You would introduce those to the urethra, starting with the smallest you think you could get in, and then working up to about a 20 French or maybe bigger than that. And that was what the treatment was, to try to stretch the urethra back out again, push through the stricture, and then that was it. You'd end up having to take a few pills and a few things like that, but those kinds of procedures were done without benefit of anesthesia, right in the office. It was an outpatient thing. Through the years, going through all the things that I've been through, it was just a matter of adapting. Sometimes I had to have a Foley catheter and leg bag or stomach bag. I'd sleep with a big bag next to me. The benefit, I always try to look for the good side. The benefit was I could sit through a whole movie and not have to go to use the restroom. Learning how to self-cath and doing that myself after the operations to keep the urethra open became so easy and normal for me, it was just part of my life. The frustration I think I've experienced over the years was just not being able to get the doggone thing to heal up and just be regular again. It was reoccurring, always reoccurring. I never knew it was going to hit. It just all of a sudden would seize up like the drum head, and that was it. And if you weren't in a position where you could open the urethra yourself with a self-cath, or you could get to a physician, I've been through some amazingly bad times in emergency rooms. I can't even begin to tell you the pain that you experience when your bladder starts to distend. And the only way that you really get them to treat you is to fall down on the floor. And then they really do pay attention to you then. In my 30s is when I decided to start to move around a little bit. I became a manufacturer's representative. And I traveled Washington, Oregon, Idaho, Montana, Alaska, and Hawaii for Wedgwood of England and later Yadro of Spain. I'd been through the Air Force from 65 to 69, and then I spent 10 years in the department store business. And it was really during that first time when I was still static in one place where I started to have the treatments done. But as I started to move around a little bit more, I ended up meeting some nice urologists in Oregon and in California. And up around Los Angeles, I worked up there for a year, so I met a very nice lady urologist up there. And when I first moved to San Diego, I needed to have a urologist, so I shopped around, and in the system I was in, I found this wonderful guy. And we got to going and talking about it, and he said, there's a lot of things. He said, I went to school in England, he said. And I've seen some amazing instruments that you never want to see. And he got my attention, and he said, you know, I stay on top of things. I try to anyway, read all the books and the newsletters and things. There's a guy up in UC Irvine who was up in Central California, in the OC up there. And he does something that no one else seems to be able to do. And that is actually take skin from another part of your body and create a new urethra for you. I don't know really if that's for you, he said, but we'll think about that. And when we got to the point where it was no longer we'll think about it, we have to. Because the last major operation I had with this doctor was devastating to my urethra. It was the scar tissue for years and years and years of these things. And it just wasn't there anymore. It was totally gone. And, or whatever was left was not much to work with. Dr. Gelman can probably attest to that. And so this doctor then referred me up to the UC Irvine to Dr. Gelman. And what an amazing, nice thing that was for him to do that. Walking into Dr. Gelman's office was initially pretty much like, okay, this is good. It's first cabin stuff here. The people are very pleasant, and the people are very competent around him. I don't think these folks don't want to disappoint this guy. He doesn't look to be like a taskmaster to me at all. But he is so good at what he does, and he's so confident that I think everyone around him picks up on that. And so I think that's one of the reasons that you like walking in there, because they seem generally concerned with you. And I know that fellow that did the x-rays and stuff, he was just a hoot. You know, he was winning some sort of an award or something. He was so proud of that. And so Gelman was proud of him as well. And he said, this is what I do, he said. And I wondered why you haven't come to me before, he said. And I said, I didn't know you existed. And so it was easy. It was very easy just talking to him, listening to him, and making a decision to have this done. Fortunately, I was covered with insurance. And even though I was out of system, they decided to go ahead and do it. And for me, there was just no decision really to be made. I mean, if here was an opportunity after 50 years to actually be normal again. And I said, I don't care how it hurts. I don't care how long I have to recover. Let's do it. And the physicians he had and the trainee, I don't know if they were trainees or doing their residency or what it was, but these guys that came in that took care of me, and I had tubes coming out of me everywhere and all sorts of stuff. I mean, they were amazing. They were just wonderful. And the nurses at that hospital were really good. I mean, talk about caring. I mean, just textbook nurse, cares for you. And when Dr. Gelman came to see me after the surgery, he said, that was a pretty tough surgery. You were on the table almost 10 hours. He said, without a doubt, that's probably the toughest one I've ever had to do. And I said, well, I'm glad you had that really special table that you built, doctor, because I must have been on it for quite a while. And he said, I never really have seen anyone that's had that many surgeries. And he said, it took some doing to give you a new urethra. It took some doing. Now here I am over a year later, no reoccurrences, no problems, nada. Zip bupkis. And I'm able to, the first time I jumped in the water, after I didn't have any of those appliances hanging off of me, it was a mitzvah. I mean, I loved it. It was just amazing. And I'd forgotten the pleasure of just jumping in the water because I couldn't do it before. Oh gosh. Changed my life. It absolutely changed my life. He was telling me that these days with medicine where it is in his particular specialty, that even after you have one urethrotomy, you should really come and have this done because there's no sense in going through all of that pain and agony for the rest of however long it takes until you come to the point where you have to have it done. People don't like to even hear about the surgeries I've had. It's not something you talk about in mixed company or is at all. Most guys, you start to talk about these kinds of things and they just start to go, they don't want to hear about it because it sounds painful and really uncomfortable. And it's just, it's a specialty. It's not as glamorous as hearts or cochlear implants or anything like that, but it is a life-changing thing. I mean, I can imagine someone who gets a new liver, gets a new heart, or they can hear again because some really amazing doctor put a cochlear implant in their ear. Well, this amazing doctor gave me a new urethra, which happens to be a pretty functional piece of the human body. In fact, when I went in for my last appointment, it was kind of a post-surgery thing, I had a gift for Dr. Gelman. I gave him Harry Potter glasses, a scarf, and a wand that glowed and made a noise when you waved it. And I told him, I looked him right in the eye and I said, Harry Potter's got nothing on you. You're the Wizard of Irvine. So when Dr. Gelman did what he did, it just literally changed my life. I mean, it just gave me my life back. I didn't have to deal with all that rubber and appliances, and I could get on with what I was doing. I was making do and getting by, but now, God, talk about enhanced quality of life. It's amazing. I mean, I'm going to, in 2 days, I'm going to go out with this boat, and we're going to go out to Catalina Island, and I'm going to go diving. We're going to go snorkeling and kayaking. And I'm going to do things that I just wouldn't even thought about doing. And I'm going to have fun. I'm going to smoke a cigar and maybe even have a scotch.